If you're planning to have a PRP injection for osteoarthritis or a tendon, ligament, or muscle injury, should you be off steroids and anti-inflammatory medications? And if so, for how long? In my latest Ask the Doctor video, I share my thoughts on that question. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. Very simple question, albeit probably one that has a little bit of debate among orthopedic surgeons that do regenerative treatment. The question is this: I have a question regarding optimal PRP injection results. Before doing PRP injections, how long must or should a patient be off of 1 oral prednisone, 2 cortisone shots, or 3 topical hydrocortisone cream? Now, just before I give my thoughts on that, just know this is not medical advice. This information, this is true on this video, all my videos on any social media channel, and on my website. This is meant for information and educational purposes only. I'm not giving you medical advice. There is not a uniform answer on this. Some orthopedic surgeons, whether it's PRP, where we draw blood, basically then put that syringe of blood in a centrifuge to spin off the red and white blood cells, and then the plasma full of platelets and their growth factors are injected into an area, PRP, or something that I like even better, autologous exosomes, where we draw blood same way, but send that blood to a lab where the exosomes from that blood are isolated and then replicated, turned into hundreds of billions of exosomes. That vial of exosomes is sent back to me, and then that 1 cc of fluid now has 200 billion exosomes injected into an area. I like that better. I think it's going to be the next thing past PRP. Both of those, especially the exosomes, are considered experimental by the FDA, but it's coming from your body, so it's not nearly as scrutinized. But having said that, there's still debate among orthopedic surgeons and physicians that do these regenerative treatments about pre-injection steroids and anti-inflammatories. My perspective of this: I'm not aware of studies that show poor results if you're on an oral steroid like prednisone, or if you're on chronic anti-inflammatories, or if you've had a recent cortisone shot. I'm not aware of studies that show that, but it makes sense that it potentially could damage what you're trying to do. The other perspective is you're spending a lot of money on these regenerative treatments. You want to give it every potential chance to work. So again, this is not medical advice, but with my patients, I try to have people off of steroids, recent cortisone shots, and ideally even anti-inflammatories for a period of time. For steroids and cortisone shots, I like it to be 6 weeks. Anti-inflammatories, a minimum of 1 week. But again, that is just sort of my sense over a long time doing PRP, and more recent doing autologous exosomes. That's just what I think. I know there are physicians and surgeons that don't worry about that at all, and they just press away. And then I do know others that are very adamant about that, like I tend to be. Again, not based on so much studies that are out there. That would be a difficult study to do. It could be done, but it would be tricky. And again, we still need a lot of data on using these treatments, primarily comparing them in randomized, double-blinded, controlled studies. But having said that, that would be how I would look at it. Now, if you have an orthopedic injury and you want to hear about options other than surgery, options other than cortisone shots, maybe it's about a regenerative treatment like PRP or autologous exosomes, you can click the link in the description under this video, fill out the contact form, and learn more about scheduling an appointment with me. I'd also love to hear your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't give you medical advice, but I might answer your question in a future video like I'm doing here. Make sure to subscribe to my YouTube channel and click the bell to be notified when I release a new video. Also, you'll be notified when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.